So in order to really understand how to prevent the disease, Dr. Stephen Chen, back in 2016, has really reviewed the articles and then given us some of the risk factors for periodontitis, such as a history of the periodontal disease, smoking, deep pocket plus the bleeding on probing, and no maintenance. So 4 to 5, 6 times, the risk factor, that's pretty high. But another interesting thing is, if they don't get any regular cleaning and they have a history of the periodontal disease, it goes up to 11 times. And just having a bad oral hygiene, it goes up to 14 times. So this is, well published. This is not mine, and this is already published, back in early 2010, 2011. That these are the very well-known risk factors for peri-implantitis. So now let's talk about the treatment. The room next to it, there's a session going on where they talk about non-surgical treatment for peri-implantitis and surgical treatment, and it's very good. And here, when I'm doing a non-surgical periodontal or peri-implantitis treatment, what I've been using is using a chlorhexidine chip that is available in the United States for the patient to treat patients with the periodontal disease. And at our school, I'm the principal investigator for the FDA phase 3 clinical trial, and this is a multi-clinical trial that we have going on in the United States as well as in Europe, trying to see whether this chlorhexidine chip in 2.5 milligram whether we can use this small chip to treat peri-implantitis. There was another study that's done by Arrestin, which is a minocycline, trying to solve the same problem. And here, what I've been able to do is I'm not able to share the final result, even though our center has finished the study. But after going through the FDA phase 3 clinical trial, this is how I am treating the patients non-surgically when they present with a peri-implantitis or peri-implant mucositis. This is my patient that after the restoration was done in place in 2010, unfortunately the patient started to lose more bone. And clinically, the area looks pretty healthy, but when you start to probe, then probing depth goes to 6 millimeter and starts to bleed very heavily. And just doing the debridement, using the stainless steel curette or titanium curette, that you could get such a granulation tissue, very inflamed tissue from the area. And many times, clinician may just end it here, but what I do differently is I place this small chlorhexidine chip. I don't give them a mouse. I place this small chip into the area, which is very easy to insert because you do have already inflammation, possibly separation of the flap, so I could insert this into the area. And I have the patient to come back in about 6 weeks, and at that point I try to probe again. Now we do have a little bit of recession, but tissue looks a little bit healthier. But I want to reduce this probing depth, so I put another debridement and then place another chip. And this patient comes back, for 19 weeks, 20-week follow-up, and when you do the probing depth, now it's pretty shallow. So this is one way that we can use the chlorhexidine to treat peri-implant mucositis or mild case of peri-implantitis. But peri-implantitis is such a disease that we have to start visualize what's happening to the implant level, not just on the soft tissue level. Back in 2016, or the last year, Massimo Simeone and our research group has published a case report on the failing dental implant. And this is a 40-year-old patient who have lost more than 50% of the bone around the implant. And unfortunately, the implant had to be removed. But we decided to use the scanning electron microscopy image to see what's happening on the implant surface. This is the moderately rough surface dental implant with the abutment that's attached to it. When you look at the SEM image, on the polished abutment surface, you don't really have a presence of the bacteria. But as we get to the rough surface of the implant, these pores, because this is a rough surface implant, the porosity of the implant, you do have a presence of the bacteria going into the pores of this implant. So let's look at the middle portion of the implant where it was readily exposed, to the environment. And here you are seeing the pores of the surface texture of the implant. And when you look at the high resolution, you could see the bacteria. This is the implant that has been taken out. But even after that, you see the presence of the bacteria. So if you are thinking that you could remove this bacteria just by using the curette, which is a very big head, or just using the mouthwash, we are literally not thinking right. So we do need to come up with a solution when you are really trying to treat severe cases of peri-implantitis. So what we've been using at our school, and we are starting to do research, is try to use a dental laser, to treat, potentially use it as an adjunct to treat the dental implant surface. And we've been using more of the erbium chromium, the YSGG laser in our case. Let me just show you about how this laser works, because this laser is what we call, so you could see how there's a micro explosions. With the erbium laser, there's a phenomenon called micro explosion that will allow us to clean the implant surface. And here we have intentionally the implant has been stained, and you could see that the laser is allowing us to remove this contaminated implant surface. So this is kind of what we need to expect, that when you're doing a peri-implantitis treatment, especially the detoxification of the implant surface, it's going to take us a long time. Because just imagine how long it's taking us to remove the stained implant surface. So back in 2014, understanding that we do have this phenomenon called peri-implantitis, we decided to use an animal model to induce very severe case of peri-implantitis around dental implant, and use a erbium YAG laser to treat the contaminated implant surface. So here, after we induce a peri-implantitis, one can see how much destruction we had. Here, but we use the erbium YAG laser to clean the implant surface. And we also use the xenograft, which was the Korean equine bone, and growth factor and membrane, to see how much bone regeneration we could get. We allowed the healing period for 3 months, and in the animal model, one case we had 100% so-called VRC intervention, which was great. But many of the cases, we didn't get to the bone formation all the way to the platform. But this is still very good enough that we do actually have evidence now that we could clean the implant surface using the laser, and then we could use the bone graft. So in my practice, when a patient presents with the implantitis, this is the case back in March 2010, where there was aggressive periodontal disease, placed a dental implant, and the case has been restored. And this patient started come for the maintenance, but after 5 years, patient reported about the pain, swelling on the buccal portion of the implant, but interproximally the bone level looked good. But this doesn't show, this is not 3-dimension, it's only 2-dimension. So I like to probe around the implant area, and as we probe, we have a 6mm deep pocket, and we are starting to have a bleeding. So for this case, I just use the erbium chromium laser to clean the implant surface very slowly. And as we clean it, you could see the very diseased tissue that's coming out. And this is at the end of the treatment. And at 3 months follow-up, we have a very healthy soft tissue, and then very shallow probing depth. So, we are only as strong as your foundation. So, as you are practicing implant dentistry, we need to think about some of the factors that are very important at the bone level as well as the soft tissue level. And also, we have to think about how we could maintain these cases. So my last slide. This is not my car. This is one of my residents' car. And back in 2016, he bought a new Corvette red sports car, and I decided to take a picture of myself. But this is my car. This is a car that I've been driving for the past 6 years. That I was a very big fan of the American car and the Japanese car. But since 2011, I've been driving the Korean car, and my wife and I, we love the car so much that we're not going to change it. So we, as a practicing Korean American periodontist, I'd like to thank everyone, especially the manufacturer of the Korean implant and the regenerative products, that you make us very good clinician by providing us with a very good dental implant as well as a regenerative products. Thank you so much.